Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, brought to you by UMass Memorial Healthcare. I'm joined by Dr. Chang, and we're here to talk about the new hypertension guidelines. So my first question for you is, what is hypertension and what causes it?
Hypertension, all that means is high blood pressure, and so that sounds like a very simple answer, but really it's when the blood pressure circulating through your arteries is higher than it should be. Plain and simple. The reason why we care is because that actually can have a lot of complications, and I'm sure we'll get into this later. So it can cause things that we want to avoid, like stroke and heart attacks and things of that nature. And the big issue with high blood pressure and things like that is that for the most part, they're silent. So people really don't have any symptoms until much, much later, when it's frequently too late to prevent anything.
What changes were recently made to the hypertension guidelines?
The big news is that the cutoff for making the diagnosis of high blood pressure or hypertension went from the numbers of 140/90 to 130/80. So that seems like a very minor change. You're really talking about like a count of 10 from the top number and the bottom number of that blood pressure, but it actually is very significant. So with that change, the number of people with high blood pressure, they estimate in the United States, goes up to about 46% of all adults.
And what prompted these changes?
There was a lot of concern that we weren't probably catching the people that we needed to catch in terms of preventing those complications that I mentioned. So those are things like stroke and heart attack. So there was a thought that maybe by having healthcare providers catch people and counsel people at a lower blood pressure, that maybe we could spare more people those bad things like having heart attacks and strokes that we really, really want to prevent.
How will these new guidelines affect patients?
There's a thought that because this is such a silent process, that really there's a lot of education that will need to happen up front. And this is not just for patients, this is also for healthcare providers that have gone by old guidelines for a very, very long time. There's basically two lines of thought regarding this. So at the lower blood pressure of 130/80, which is now the new cutoff for having high blood pressure, it's thought that you actually don't need to necessarily start any medications. However, it's important for you and your doctor to actually have a discussion about what's the next step. So from an actual medication standpoint, there might not be any changes, to answer your question. However, it's prompting earlier discussions, and that was the main hope of the guidelines themselves, and the people who constructed this was to actually get that discussion to happen earlier about all the things that we'll talk about in a second that actually impact blood pressure, even aside from medications.
If a patient is currently being treated for hypertension, would these changes affect their treatment, and should they contact their doctor?
The main thing that this would change is the target blood pressure. So for people already taking medication, they may need to contact their doctor to just ask if my medications are enough. The other thing, because one of the goals of these guidelines is to promote lifestyle changes and non-medication interventions to lower blood pressure, is there anything I should be doing to lower my blood pressure so that I can stay within these new guidelines?
What are some rules of thumb that a person with hypertension should always follow?
This is a great question. So, I think the biggest thing to keep in mind is that blood pressure can actually change pretty rapidly, even minute by minute. So that your first blood pressure when you enter the doctor's office on a busy day might actually not be most accurately reflective of your actual blood pressure state throughout the day. So I keep on referring to the guidelines because they actually do recommend a very stepwise approach to measuring blood pressures. So one of the things that patients should keep in mind is actually the importance of rechecking blood pressure and being knowledgeable about checking your own blood pressure at home. And most practices and doctor offices can actually help with that. So that's one thing to even ask your doctor at your next visit. The other thing to keep in mind, as I've been sort of referencing throughout this interview, is the importance of lifestyle. So things like diet and looking at salt intake, looking at how much alcohol and caffeine you're drinking, looking at things like smoking and how much you're sleeping. These are things, I'm even guilty of it, of not spending enough time to sort of talk about with patients. But with the new target being as low as it is, we're really looking to sort of make these things stand out as what to do to avoid being started on medications. So whether or not you have severe hypertension or not, these are all important things to keep in mind.
When I get my blood pressure taken, what do those numbers mean?
The numbers that we reference in terms of talking about your blood pressure actually have to do with a little bit of the contractions of the heart. So the systolic blood pressure, or the top number, is actually the number that references sort of the heart contracting and your vessels kind of clamping down. So that's just one number that we look at when we look at sort of how much pressure your body is exerting and your arteries are exerting. The lower number, or the diastolic blood pressure, is actually the number when your vessels relax and your heart is not actually contracting. So there are two different numbers, and there's something called systolic blood pressure and diastolic blood pressure. The 130 over 80, the 130 is the systolic, the 80 is the diastolic. Actually, if either of those numbers are high, so if, for example, if your number is 140 over 80, so that actually means that you actually have systolic hypertension. In contrast, if you actually have a blood pressure of 130 over 90, that would actually mean diastolic hypertension. So there's two types of high blood pressure.